Mark. Tonight in Medical Rounds, this Saturday marks a big night in Hartford. Hartford Hospital's 26th annual Black and Red Gala at the Bushnell. And this year's beneficiary is the Neuroscience Institute. And joining us live tonight is the newly appointed physician-in-chief of the Hartford Healthcare Neuroscience Institute, Dr. Mark Alberts. Good evening, Dr. Alberts. Thanks for joining us.
Hello, Denise. Thanks for inviting me.
Well, as you know, every year the Black and Red Gala raises awareness for an important public health issue. And this year it's about knowing the signs and symptoms of a stroke. And you are encouraging people to think fast. Let's talk about that for a second.
Well, that's right. Stroke is a very common medical emergency. It's the 5th leading cause of death in the United States, but a lot of people don't know the symptoms of stroke and they don't know what to do. So some of the common symptoms of stroke include facial weakness. That's where the F comes from. A means arm weakness or trouble with arm coordination. S is for speech, slurred speech or trouble understanding what somebody is saying. And T means time. If you or a loved one is having any of these symptoms, it's time to pick up the phone, call 911, or get to the nearest stroke center as rapidly as possible.
That's right. Every second counts. And your background, of course, is as a stroke expert. You helped develop national standards for hospitals to qualify as stroke centers. And I've wondered, why is that so important for a hospital to be qualified in that way?
Well, Denise, it is very important because it's a misconception that every hospital can treat stroke patients the same way. Many hospitals do not have the staffing or the procedures to provide patients with the best possible care and the newest treatments as rapidly as possible. Fortunately, Hartford Hospital is a comprehensive stroke center, which is the highest level of recognized stroke center, not just in the country, but in the world. So if they come to Hartford Hospital, they will get the best possible care 24 hours a day, 7 days a week.
Good to hear. Now, Dr. Alberts, we have just a few seconds left. Perhaps it's not even fair to ask you this, but what will your role be in helping to create a model for Hartford Healthcare's Neuroscience Institute now?
Right, well, that's a great question. The Neuroscience Institute is going to provide multidisciplinary care for patients with some of the most common neurologic and neurosurgical diseases, including epilepsy or seizures, Parkinson's disease or movement disorders, headache, pain syndromes, ALS, Lou Gehrig's disease, and the like. So these are very common diseases that affect millions of people in the state of Connecticut.
And they'll have some new help there thanks to Hartford Healthcare. Thank you so much, Dr. Alberts. Good luck with that ambitious program. Your goals are lofty, and I have no doubt you'll be reaching them. Thanks so much. Now, Hartford Hospital's Black and Red Gala will be held this Saturday night at the Bushnell. If you'd like to learn more about this year's campaign, Think F.A.S.T, we have a link to more information on our website. Just go to WFSB.com.